Concern over the Delta variant of COVID-19 is certainly increasing. So let's talk about what we all need to know at this stage in the pandemic with Dr. Ruth Berggren, infectious disease specialist with the Long School of Medicine at UT Health San Antonio. Doctor, thanks as always for joining us on this Thursday. Can you give us an idea where we are locally with infections related to the Delta variant and also how this version of COVID operates, so to speak?
So we've been monitoring for Delta variant at our Health Science Center, and we look at hospitalized patients and we do sequencing data, and that gets updated every month or so. But by June the 1st, we were already at 17% Delta variant, and we are now a month beyond that. And so I think it's probably a fair estimate that greater than 20% are Delta variant. So it is here. And it's of concern because this variant is both more infectious and makes people sicker. It makes people sicker quicker, and it is causing surges in places that have had really good vaccination rates. It doesn't hurt the vaccinated people in the sense that vaccinated people don't get sick enough to go to the hospital with Delta variant, but it is very important, and it is hurting the unvaccinated population.
With the Delta variant now obviously here in our community and spreading elsewhere very quickly, the World Health Organization has said it wants people to go back to wearing masks, even if you are double vaccinated. The CDC has not taken that step yet, but we're starting to see kind of a mixture throughout different states where this is running wild, where masks are coming back, and we expect that here.
Right. And the CDC has actually gone on record as saying it's putting this back out to states and local governments. And there are that is reasonable, considering that there are some counties where there just really isn't a lot of COVID, and there are other places, urban areas that are more densely populated, and there's some pockets that are more vaccinated than others. So on Monday, a lot of counties across the United States had health departments start to recommend that all vaccinated people continue to mask when they're indoors. We have not done that, but I want to stress this point. If you are elderly or if you are immunocompromised, meaning your immune system isn't strong, that would be, for instance, people who may have cancers, people who may be on treatments that suppress their immune system for autoimmune diseases like multiple sclerosis or rheumatoid arthritis. If you're one of those people, even if you're fully vaccinated, you really ought to wear masks, wear good masks, and avoid crowded indoor places. So I think that is applicable right now in our own Bexar County, that older people, and I would say anybody over 65 and anybody who's immunocompromised would be wise to be strict about masking, even if they're fully vaccinated.
Would you recommend, for people who don't fit into some of those specialized categories that you just mentioned, would you recommend still wearing a mask if you're indoors but can be socially distanced?
So if you're vaccinated, you're indoors and you can be socially distanced. So let's say that's me going to HEB. I have preferred to continue to wear a mask there, but there's no mandate to do that. I think it's an extra precaution. I don't expect to get the Delta variant. If I do, I expect that it will not send me to the hospital, but I'd prefer not to take any risks at all.
So here locally, they said this week, we've got about 73% of the population that's had at least one of the doses of the vaccines. But meanwhile, the worldwide is only about 11%. So if we don't continue to see that, we're doing great here. That's wonderful. But if we don't see more people get this, are we ever going to get rid of COVID?
No. And I think that all of us should be remembering that we are not just residents of Bexar County, right? We are citizens of the country, and we are global citizens. And an infection anywhere is a threat to our health and well-being everywhere. And when you have places like Haiti, which is only an hour flight from Miami, beginning to see surges. We've lost healthcare professionals, people that I personally know, have died in Haiti because of COVID. When we see that happening and we look at the numbers and how little vaccine has gotten there, we really have to remember, number one, we have a responsibility to one another for humanitarian and ethical reasons, but also that when the virus runs rampant, when it replicates unchecked in nearby countries, more mutations will occur. And we already know that the more mutations happen, the more likely the virus is to begin to escape from the immune protection that's provided from the vaccines.
And let's talk about that when it comes to how effective these vaccines are against the Delta variant. I know it's something we've touched on here before, but I think it's important to reiterate because it seems like with this variant, correct me if I'm wrong, if you only have one dose of the vaccine, your protection is far less than before Delta arrived.
That's right. So if you only get one dose of Pfizer or Moderna, the mRNA vaccines, you only have 33% protection. And it used to be a lot better than that before we started having these mutations. After your second dose, 2 weeks after your second dose of one of the mRNA vaccines, your protection goes up to about 87%. Not quite as high as we were seeing before the Delta variant, but still very high and still very good news, and fully protective against really severe disease and death. So that's what we know about the mRNA vaccines. When it comes to the adenovirus vector vaccines, of which Johnson & Johnson is one, we actually don't have population-level data for the protection by Johnson & Johnson versus the Delta. But a lot of people are extrapolating based on data from AstraZeneca, which is a similar platform. And there we're seeing reduced protection in the 60 to 67% range. And people are inferring, therefore, that if you just had a J&J, you're probably only 60% or so protected from the Delta variant. You're still going to get a lot of benefit in terms of protection from severe disease, going to the hospital, or dying. I hope that clarifies it, but please ask me follow-up questions if it's not clear.
I think it does. Dr. Ruth Berggren, we always appreciate you helping us break this down and understand better where we are at this point in the fight against COVID. Thanks for being here.
Happy to be with you.
Thank you, Doctor. Have a good holiday weekend. We'll be right back.